So we will record. So hello everyone. Welcome to the Duodopa overview and Q&A webinar with Eric C. My name is Declan Beto. I work in client services with the Parkinson Association of Alberta, and I'll be the moderator for this webinar. If you have any questions during the webinar, please submit them in the chat box below. There should be a little chat blurb icon. You can click it and the chat will appear on the right-hand side. And then you can send your questions out to the whole group or just to the panelists with the little drop-down arrow. And quick disclaimer, all information provided in the videos by Parkinson Association and the featured speaker is furnished strictly for educational and entertainment purposes only. This service is not intended to be diagnostic, prescriptive, or replace the relationship, advice, and or care of your physician. General questions about symptoms, treatments, available medications, complementary and alternative healthcare therapies, and current research will be fielded. And this presentation is brought to you in part by AbbVie Pharmaceuticals. And now let me introduce Eric. So Eric C. is a Duodopa nurse at the Calgary Movement Disorder Program. He has a geriatric nursing specialization and has previously worked at Cognitive Neurosciences and the Seniors Health Clinic. So welcome, Eric. Thank you so much for being here.
Hello, thanks for inviting me. Yes, so I was invited to do a short little talk on Duodopa, which is a advanced therapy used for Parkinson's disease. I'm going to try and keep things pretty basic. Long and short of it is, if you think that you are appropriate for Duodopa or you're interested in starting Duodopa, we can certainly talk in more detail, and probably your doctor will actually have introduced it to you in advance. So I'm just going to talk briefly about what Duodopa is, how it works, the various benefits and side effects, and hopefully I'll be able to answer any questions that you folks may have too about Duodopa. That is probably going to be the bulk of the presentation, actually. Quick little disclaimer. AbbVie is the drug manufacturer for Duodopa, so they cover the funding for the RN position, my position here at the Cognitive Movement Disorders Program. Otherwise, I work for Alberta Health Services generally. And secondly, that this presentation is specific to Calgary's Movement Disorders Program. Edmonton also has a similar program. We differ somewhat in the individual steps and the referral process and such, but the medication and the therapy are largely the same. So most of it should be applicable to Edmonton too, and of course to surrounding areas if you live outside of Calgary or Edmonton. All right, so what is Duodopa? The long and the short of it is it's not anything fancy. It's essentially levocarb in a gel form, the same medication that you take for your Parkinson's, but it is used to treat Parkinson's disease by use of a pump instead of pills. It replaces your other oral Parkinson's meds. You may still have one or two meds. You may still have some bedtime medication, but it generally replaces what you take during the daytime. The magic of how it works is that the levocarb gel is infused into the body using a pump during waking hours. So that's given at a slow, steady drip rate all throughout. And the general benefit is that compared to oral medication, Duodopa offers us finer control over the levodopa levels in the patient's body. It lets us really finally get down to exactly how much medication a patient needs at a time. I'll show you what the pump itself looks like. It's very much like this. There's a few components to it. Let me just pull out my laser pointer here. Here's the pump itself. This is what delivers medication into the body. You turn it on and it just runs all day, set rate, constant drip feed of medication. This is a cassette, which is a reservoir of levodopa gel, and one cassette contains 20 pills equivalent. Most people don't end up using the entire cassette in a day. But basically, this is just one big storage reservoir for the gel. The gel just makes its way through to this little fake tummy that I have here via a fancy tube called the PEG-J tube. which is what provides access for the gel to get from the outside of the body into the small intestine. Peg J stands for percutaneous endoscopic gastrojejunostomy tube. Big fancy term, you don't have to remember it. The name itself is about as long as the tube. I also have here a little cross section of what it looks like. And actually, I have the tube itself, the pump itself. It's about yay big, about the size of a hand and a bit. It weighs about a pound. So this is something that you wear with you. You can see in the diagram here, this is what the whole system looks like. So you've got the tube, goes down and through, enters the body, bypasses stomach, and goes to the small intestine. So this is the true magic of how Duodopa actually works. With this pump, we can deliver medication directly to the small intestine via the tube using basically bypassing the stomach entirely. So the big advantages compared to the pills are there's fewer ups and downs compared to oral administration. And also because it bypasses the stomach, the medication can be directly absorbed. There's no need to wait for the stomach itself to digest the medication. There's no need to fuss around with how your Parkinson's is doing and how it's affecting the GI system. It's generally more predictable compared to standard therapies. I'll dig into that a little bit more here. Probably if you've attended other Parkinson's educational seminars or if you've talked to your neurologist, you probably know the concept of motor fluctuations and the ups and downs of Parkinson's over the course of the day. I'll do a brief review here just in case, okay? When you have Parkinson's, you have low levels of levodopa in your body, and that usually manifests as what we colloquially call off symptoms: stiffness, rigidity, tremors, and that can vary from person to person. The main way to treat that is by taking levodopa. Levodopa will build up in the body when you take a pill, and as levodopa levels start to climb in the body, eventually you cross a certain threshold where you're considered to be on. On is the general everyday term that we use when someone is feeling well controlled, not bothered by their Parkinson's, moving around okay. That's this big green zone here. At some point in Parkinson's, some people start to experience peak dose effects, usually called dyskinesia. And those are usually sort of restless movements, writhing movements, little wiggliness or dancing. And those can occur when levodopa levels reach a sort of quote unquote too high level. I say quote unquote because usually people are able to tolerate it without too much issue, and most people would prefer to be able to move around rather than having the Parkinson's symptoms. But broadly, you take a pill, your symptoms are relieved, you get into this on zone, you might have a little bit of peak dose effects, and then as levodopa levels start to clear out of the body, you take another pill, and then you're back in action for a bit, and then you take another pill. That's how Parkinson's usually works. It's a gross oversimplification, but for our purposes, I think that'll be quite representative. Now, in advanced Parkinson's, that green on zone decreases by quite a bit. People have very narrow windows of control. So that usually manifests as delayed on time. So you take your pill and it just does not seem to be working for a long time. And then when you do get on, you're only on for a short time before you start to experience very bothersome side effects, such as dyskinesia, but also such as nausea or dizziness. Most commonly, it is the dyskinesia. And then the end result is that you spend very little time over the course of the day where you're actually well controlled. And Parkinson's is usually quite burdensome during these off periods when you don't have enough medication, or it's quite bothersome because of side effects from too much medication. So there's also other things that can happen with Parkinson's too, such as doses failing entirely, such as doses taking uncommonly long times to kick in. Some people get very sensitive to the side effects of levodopa, so they can't take too much medication. The gist of how the Duodopa works is that because we can have very fine-grained control over your levodopa levels, instead of splitting the pills into halves and then taking it every hour or every 2 hours and then taking 2 pills and 1 pill. It simplifies the entire regimen by simply having a small, slow drip feed of very frequent levodopa infusions all the way throughout the day. So the upshot is, on Duodopa compared to the pills, you get more on time, you get fewer side effects, and the main goal I have is that when you're on Duodopa, that your most burdensome symptoms of Parkinson's are relieved. Most commonly, we target motor symptoms when it comes to starting Duodopa. The easiest things to work on are things like stiffness, things like rigidity, and slowness. We can also treat the dyskinesia fairly well too by making adjustments so it doesn't run too high. But also, from my experience, I've also seen that some non-motor symptoms are also relieved by Duodopa. Because it's the same medication compared to oral levocarb, we can pretty much predict what sort of things Duodopa will help with. The same sort of symptoms that are responsive to the levocarb, those are the same sort of symptoms that we can target with the Duodopa. Of course, the flip side is also the same. The symptoms that are not responsive to levocarb will probably not respond to Duodopa. So certainly Duodopa is not a magic bullet. It's not a cure. You won't get 100% uptime. Probably you'll still have bad days on Duodopa. Probably you will still have bad times a day on Duodopa. And of course, the Duodopa won't help you when it's not connected. So we usually only use it during daytime hours. Nighttime hours, you'll probably still be on your regular pills and such. But that said, when it comes to numerically how well Duodopa works, generally the research studies say that on Duodopa compared to pills, you might get about 4 hours on average where you have more on time. And for patients with really bothersome dyskinesia, you might get about 4 hours where the dyskinesia is not as bothersome. I went briefly over how Duodopa is generally set up compared to oral medications kind of a few minutes earlier, but this is generally how the daily routine is. In the morning, you take the pump, set it up, and you hook it up to the PEG-J tube, and you take a morning dose, which is a larger than normal shot of Duodopa gel that's designed to get you up and ready to go without needing to wait a long time. After that, the pump kind of just runs itself all day at the same rate. If you start feeling like the Parkinson's symptoms are coming back, you might take an extra dose, which is a 1-button press operation, and that will just give you a preset booster shot of Duodopa to get you back up into the on zone. You take that when you need. At bedtime, whenever that is, you simply disconnect the pump, turn it off, and you flush the PEG-J tube out with regular old water just to keep the line clean. Then you go to bed. So this replaces your regular Parkinson's regimen. Instead of needing to take pills every 3 hours or every 2 hours or whatever, you simply hook it up in the morning, let it run, you live your life how you like, and then at the end of the day, you just disconnect and clean up the pump at the tube. Hopefully, if that makes things simple. The overall process for applying for Duodopa is not as simple. There's a few things to go through. Probably by the time you consider Duodopa as a possible option for your Parkinson's, I don't think it will be a surprise to you, nor will it be a surprise to your doctor. They will probably actually be the ones to advise you that, well, the standard Parkinson's regimen is not really working. You've tried a few combinations of pills and such, and you're still having quite a bit of symptoms. So the next step would be to consider an advanced therapy such as Duodopa. Once that initial discussion is made, usually the next step is that I make contact with interested parties, and I just start to basically go through this sort of teaching session where I introduce Duodopa, talk about how it works, talk a bit about the risks and the benefits. At the same time, there's also a fair amount of assessment that's required. So we do have in Calgary movement disorders, we have a Duodopa specialist doctor, Dr. Justina Sarna. She basically does her own assessment and makes sure that Duodopa is a good fit, that the risks are worth the potential benefits of starting the Duodopa, which is important too, because when Parkinson's gets to an advanced stage, people's symptoms start to get quite severe, and also they tend to differ quite a bit from patient to patient. So it's important to have a very careful assessment beforehand, just to make sure that your particular disease profile is going to be responsive to therapy. While that neuro assessment is made and while that's booked in, we also book in a GI assessment. So of course, we got to put the tube in too. We have a couple of GI doctors who are specialized in inserting the Duodopa tubes, and they take care and make sure that the tube itself is safe to put in and there's not going to be any risk of issues arising from the surgery or from prolonged use of the tube. Once our neurologist is satisfied that Duodopa is going to be a good benefit, once our GI doc is satisfied that the tube is going to be safe to put in, then we proceed on to actually putting the tube itself in. During that process, there might be a few back and forths where before we try Duodopa, we would try some medication changes or some non-pharmaceutical interventions like exercise rehab and such, just to make sure that we've tried everything possible before we move on to advanced options like these. That might also involve the use of what we call a NJ trial, which is essentially a nasojejunal tube. An NJ trial is used in cases of people where either we have questions about how well Duodopa is going to work, or family or patients are kind of, well, I'm not sure if this is going to be effective. In which case, before we actually put in the tube itself directly, we can snake the tube up through the nose down to the small intestine and try out the Duodopa that way using the NJ tube. The advantage of that is if the tube works, we can go on to the PEGJ, and if the tube doesn't work out and Duodopa isn't a good fit, we can simply pull the tube out. No need to make any surgical incisions. It's just very quick, one and done, no problem. At least we tried it out and people go back on the pills. The actual surgical procedure itself, the PEGJ insertion, is fairly straightforward. The GI docs don't even really call it a surgery. You don't stay in hospital for it. It is something that we manage solely on an outpatient basis. You come in the morning, our GI doc puts you under general sedation, and it takes about an hour to just make a little punch hole through the belly, use a camera up down the esophagus to move the tube to the right spot, and then just tighten everything up and put a dressing on top. And in the morning, out by lunch, and then you heal up at home. The healing process takes about 1 to 2 weeks, and once the tube is nice and stable and the area looks well healed, then we actually just start the medication. Again, that is managed as an outpatient. I like to have people come into clinic so that I can actually start Duodopa directly, keep my eyes on them, and I usually take about 2 or 3 days to just adjust the medication up and down to make sure that Duodopa patients are receiving the exact amount of medication they need to stay in on state without too many dyskinesias or Parkinson's symptoms coming back up. Again, that's managed as an outpatient. No need to stay overnight in hospital. We just have people come in the morning and leave in the afternoon and just keep using them. Once the medication adjustments are done, that's called the titration process. People just stay on therapy. It's back to regular old life. Occasional follow-up with the regular neurologist, and occasional follow-up with me if there's any rate adjustments that are required in response to changing symptoms or issues that might arise with the pump or with the tube. So that's about the gist of how Duodopa works. The long and the short of it, just review, is that is just a regular old levocarb gel form applied via a pump. Because it's counted as invasive therapy, there's a few hoops to jump through with regards to getting assessed by our doctors and getting assessed by me to make sure it's safe. But once it's on and once it's running, people generally find that their Parkinson's symptoms basically go back to where it was in the early stages, and then later on it still continues to progress, and then we make more adjustments. But by and large, people usually find that their symptoms are well controlled overall. So I do have here a list of generally frequently asked questions that people bring up to me in clinic. So I'll just go over these. These that cover basically kind of the everyday, and they also talk. I'll also talk about the side effects and such too. First of all, most people ask, should I be on Duodopa? Chances are, if you are not, if you don't have advanced Parkinson's, you probably don't need Duodopa. Duodopa is generally used for people who have tried many types of medication, but their Parkinson's is still extremely burdensome and very persistent over the course of the day. The vast majority of our Duodopa referrals come from the Parkinson's, from the cognitive movement disorders clinic. So if you are part of the clinic, at some point in your Parkinson's disease, one of our neurologists will probably tell you, well, maybe it's time to consider Duodopa as an option. If you're not part of the movement disorders clinic, they will probably make a referral to movement disorders long before you actually get considered as part of the Duodopa process. Still, you can ask your neurologist if you have any questions about it. Broadly, I can say that advanced Parkinson's is essentially symptoms that are very difficult to manage over the course of the day, that are very burdensome and or very persistent. Quality of life being severely impaired, so really a lot of difficulty with just performing day-to-day tasks. And it can include a huge variety of motor and non-motor symptoms. So not just like the tremor or stiffness, it can also include difficulties with walking. It can include dyskinesia that affects your balance, dizziness, nausea, even things like sweats, pain, the more uncommon non-motor symptoms. Those are things that we can look at too. Here's the formal screening criteria that we use to see if people are a good fit for Duodopa. The long and short of it is you have to have levodopa responsive Parkinson's disease. You have to have symptoms that respond to Sinemet. This more specifically, you probably will have off symptoms for greater than a quarter of your waking day. You probably may or may not have severe dyskinesia on top of that. You're probably taking very high doses of levodopa overall very frequently. And definitely your meds will probably not be working by the time you meet me and the rest of the Duodopa team. There's other influencing factors too that determine how appropriate people are for Duodopa. A motivated doer, if you actually want to have Duodopa. Other associated symptoms besides the classic motor symptoms. Of course, how effective your oral levodopa is and what it works on. And also, if you have strong support systems, that tends to work very well with Duodopa. Of course, there are things that make people not suitable for Duodopa. If you don't want to do it, of course, we wouldn't start you on it. If we judge that it's either unsafe to put the tube in or unsafe to operate the pump itself, we will certainly hold off on using Duodopa as an option. And of course, if we do our assessment and we find that your Parkinson's becomes okay to manage again after a couple changes, we'll just hold off on actually going ahead with Duodopa. So generally, the wait time for Duodopa and the overall process tends to vary because it's an ongoing process with adjustments back and forth before we actually commit to putting in the tube and starting. How is Duodopa provided? You saw at the beginning, it comes in a little cassette. Each cassette contains the equivalent of about 20 tablets. One cassette lasts about 16 hours a day. So when you actually start Duodopa, we contract out to Shoppers Health Network. We have one particular pharmacy in Calgary that delivers out to Calgary and surrounding areas. And they give monthly deliveries of Duodopa cassettes. So 28 cassettes at a time in a big cooler box, and they pass it over. You pop it in your fridge, and you use one cassette a day. Next delivery comes in about the next month. You still keep your regular pharmacy for other medications, for your nighttime levocarb, and for any adjunct medications you might have. And yeah, most patients will use one cassette per day. Some patients have very high levodopa needs. They might use 2 cassettes a day. A lot of people ask me if it's possible to either swim or shower or engage in water sports or bathe with Duodopa. It is. The pump is not waterproof, but the tube itself is waterproof, and the stoma tends to form a good seal. I generally advise people if they're going to do any sort of immersion in water that they stick to water that is clean. The tube itself is certainly waterproof. You want to disconnect the pump before you get in the shower or anything like that. Because Duodopa is just infused as needed when it's running, there's not too much reserve compared to pills. So you'll probably need to give yourself a booster shot of levodopa either before you get in the shower or after you get out of the shower. A lot of people ask me too how much Duodopa costs. The good news is that in Alberta, the cost is entirely covered, which is good because out of pocket, the cost of Duodopa is about 66 grand a year. So we are very blessed here. Other provinces also have a similar arrangement where the public insurance is covering Duodopa. That the upshot of this means that there's usually a few hoops to jump through before we get Duodopa covered. That's part of the overall referral process. So we might try you on a few alternate medications first. And we definitely do a in-person assessment to make sure that you fit the Blue Cross criteria for to qualify for Duodopa coverage, which is pretty much the same as the screening criteria from a few slides ago. If you are on a private insurance plan, most private insurance providers will also cover Duodopa, either in its entirety or the majority of it. And we can apply to Blue Cross for the remainder of the cost if your private insurance only covers, say, 80% or 90% of the cost. That's no problem. The Duodopa special authorization and coverage is renewed every year. No muss, no fuss. We just do that as part of the regular ongoing Parkinson's follow-up in our clinic. People usually ask too, can I travel or go vacationing with Duodopa? Absolutely, that's not a problem. You just need to make sure that where you're going, that there's refrigeration facilities on site. You want to definitely bring your regular levodopa pills as a backup, just in case any issues happen with the pump or with the tube. You also want to make sure that beforehand you give a call to AbbVie Care so they know and so that they can go over like some particulars about traveling with the medication and traveling with the pump and all of that. Airport security is generally quite good about Duodopa. They don't really care too much about the pump. It's very obvious it's a medical device. Sometimes they give grief about the cooler bags that you use to store Duodopa when you're going on the flight because the ice packs are counted as a liquid. But the people I have who go on vacation with Duodopa haven't been too many issues. You just bring a cooler bag that we provide, stuff the Duodopa inside, they go vacationing and just make sure that they have a refrigerator at their destination. Now, even though Duodopa is, it's a tube that goes in through the stomach and through the small intestine, it doesn't affect diet at all. We only use the Duodopa tube for Duodopa only, and maybe a little bit of water to flush the tube. You still eat as normal. Your diet is not affected. The only thing that really changes is that you probably should not eat celery or other vegetables with long fibers. Duodopa, the little tube that goes to the small intestine, has a tiny little loop in it. So if you eat foods with long fibers, it might get tangled up on that sort of curl, which might cause debris to build up on the outside of the tube. And of course, as a standard sort of disclaimer, the response of protein to levodopa doesn't change. So even though Duodopa should theoretically bypass that, in practice, protein can still interact with the gel inside your digestive system. So it may still cause a blunted levodopa response, which basically means even if you're on Duodopa, if you are the type of person who is very sensitive to protein in your meals, you probably might want to take an extra dose before you eat your meal or after you eat your meal. Most common question I get is, what if something happens with Duodopa? What if the pump breaks? What if the tube cracks? What if there's an issue with the medication itself? The good news is very rarely are these things emergency, life-threatening issues. What you do is what I call the backup plan. No matter what, if there's issues with Duodopa, you stop the pump, you go back on your regular Parkinson's pills, and then you call the clinic. And then we can resolve whatever's come up just over the phone. All of the nurses here at the Cognitive Movement Disorders Clinic are trained in Duodopa, so they know what's going on. For any specialist issues that the other nurses can't issue, they usually just send me a message and I'll be able to make contact and resolve the issue. Of course, when you're back on the pills and when you're waiting for me to get in contact with you, it is quite burdensome, I can't lie. However, I hope it's reassuring to know that no matter what, you've got the backup pills and at least you'll be back to where you're at pre-Duodopa while you're waiting for the Duodopa to get restarted and for the issues to get resolved. Now, the last thing I want to go over here is formally what the general side effects are of Duodopa and the surgical procedure and such. This information is available on AbbVie's website. It's available on the Duodopa monograph. Certainly, I provide that information too as part of the teaching process. So I'm just going to go over the general basics here. The medication itself, because it's very much like regular oral levocarb, we can reasonably predict what the side effect profile is like. Nausea, dizziness, hallucinations, impulse control disorders, and dyskinesia. Those are the main ones. Exact same as regular oral Parkinson's meds. So we just continue to watch out for that. And as Parkinson's symptoms progress and we increase the rates and adjust things, we might find these symptoms pop up again. So that might affect how we adjust the medication. Side effects of the PEG-J tube itself. Generally, the tube works pretty well and sits in place without causing too much fuss. Most commonly, what comes up are local skin infections, which can happen. And when they do happen, they usually manifest as itchiness or redness at the site. It can manifest as increased discharge or tenderness. If that happens, you can basically just go to your family doctor. They can prescribe a course of antibiotics. It takes about a week of pills, and then usually that just clears things up right away. In people with who have a lot of dyskinetic movements, that can make the tube slide around inside the belly a bit, which can cause some irritation right where the belly meets the tube. That usually manifests as scar tissue, which can look like a little pimple or like a skin tag. That skin tag can be rather tender, and it can also have a bit of discharge too. So if that happens, I usually tell people to clean more frequently and just tighten up the tube so it doesn't move around as much and secure the tube. Those are the two most common things. They don't affect how the Parkinson's medication itself works. However, they can get rather burdensome, and it is a sort of hands-on, ongoing maintenance factor when it comes to using Duodopa. Inside the body, occasionally the tube itself can move out of position. You see here in this diagram, theoretically, it should stay in place in the small intestine. However, because the tube itself is not sewn in or anything, it can move back into the stomach. And if it does, you'll generally find that your Duodopa is not working as well. And we might need to do an X-ray and do a short endoscopic procedure to just move the tube right back into its proper spot. No other incisions needed. It's just putting the camera in, grabbing the tube, and just shuffling it back in place. Sometimes it just moves back into place on its own too, but know that that can happen. The one big thing that can happen that is considered to be a life-threatening emergency is if debris builds up on the outside of the tube. Kind of as I mentioned earlier in my diet slide, if there is a lump of food matter that starts to accumulate on the outside of the J tube, that can form a bezoar, which is just a fancy term for just a block of food debris. If that happens, it can block the small intestine. You will notice huge intestinal pain. You'll notice vomiting, nausea, and you'll know it's probably time to go to the emergency department so you can get an X-ray, and so we can remove that bezoar right away and restart Duodopa. very, very rare for that to happen. I've seen it, I think, once or twice. Both times, the patient went to the emergency department, the reservoir got removed, and we just put in a new tube shortly after. Possible side effects related to the surgical procedure. I don't think this will be too surprising to people. It's mostly bloating at the site. It's mostly infection, possibility for a local site infection, similar to when the tube's put in. If that happens, we use antibiotics. And we use antibiotics anyways during the procedure to reduce the risk of that. Abdominal pain and soreness is definitely an issue that can come up as the site heals up. And because we use a camera down the esophagus to manipulate the tube on the inside, there's also the possibility of pneumonia, which is, people with Parkinson are a bit more susceptible to that too. Generally, though, I would consider the PEG-J insertion process to be a relatively low-risk procedure. The vast majority of them go quite well. Finally, how long can Duodopa be used for? It is an ongoing process. Most of the time, compared to pills, Duodopa works better, even as the symptoms progress and advance. So the vast majority of the patients we have using Duodopa stay on Duodopa and will stay on Duodopa all the way until it is unsafe to use, which is quite a ways down the road. I do have some people who have considered going back on pills, either because the tube itself is causing issues, or because they're not really seeing too much benefit compared to the maintenance of hooking up Duodopa and keeping it running. Or family members are thinking, well, maybe it's just time to simplify things a bit more, in which case we just remove the tube, go back on the pills. The site heals up in about 24 hours. You get a little dimple afterwards, a little surgical scar, but certainly nothing else is affected. And then we can certainly just switch back to the regular oral therapy afterwards. I think compared to other advanced therapies, such as deep brain stimulation, it is a safer thing overall because it doesn't impact the brain, and because we can remove all the apparatus right away if there's any ongoing side effects. So that's pretty much the basic run through of Duodopa. If you have any questions or if you want to know more, you can certainly give me a call by contacting Calgary Movement Disorders. There's a number right there for the clinic. You just leave a number at 944-4364. Select option 5 for the nursing line, and you can leave a message for me, Eric C. That's no problem. I'm happy to talk about Duodopa any day of the week. You can also take a look online. AbbVie, the drug manufacturer for Duodopa, has their own website where they have the same information for Duodopa that I just presented. When you log in, you can log in as a guest. You don't have to make an account. You can just put in the Duodopa drug identification number right here, or you can actually give them a call. And you can request them to mail you some information booklets, again, with the same information that I presented here. So that's about the basics of Duodopa. I'm happy to answer any other questions.
Perfect. Thank you so much, Eric. That was very thorough. And I learned a lot as well. So yes, for everybody in attendance, feel free to put your questions in the chat box, and I'll begin reading them out. So we've got one so far. Does Blue Cross cover the cost in Alberta no matter what the patient's income is?
Yes. So, well, with one caveat, it is covered by Blue Cross. If you are on low income, such as AISH will cover it entirely. They basically are used as an intermediary. So if you are on AISH, it just means we have a couple more forms to fill out. From the patient end, there's not too much difference. We will still get it covered. That's no problem.
Awesome. Thank you. So we had another question come in. If you give, so they're asking, if you give extra shot for protein meal, does that cause more dyskinesia? So I think they're asking, if you were to have a protein heavy meal and you wanted to use the extra pump feature, is that going to put you back into that dyskinesia range?
So When we do the titration process and do the medication adjustments, one of the things I can adjust to is the size of the extra dose. Ideally, I like to get people on when they press the extra dose without shooting up into dyskinesia. So during that adjustment process, we may do a few days where I have people eat regular meals, try it out with protein, and then try the extra dose. And if we see that dyskinesia pops up after a protein-rich meal, we'll lower the size of the extra dose to try and accommodate that too.
Awesome. Thank you. And thank you for submitting that question. So again, feel free to put more questions here. I've got a couple questions of my own that I'll pose while we're waiting on
Sure.
others. So you mentioned there's a GI assessment. So if a patient's got something a disease that affects their GI tract, like IBD or Crohn's, does that affect their chances of receiving the surgery? Is there other complications?
So I can only speak generally to this because I basically leave it up to the GI doc.
Sure.
When it comes to like IBD or Crohn's, chances are it won't affect because those are located farther. Most of the time, it's located farther down in the GI tract. The tube itself only reaches to that first little part of the small intestine in the jejunum. It really does not go too far down at all. The diseases such as Crohn's generally go farther down. But that said, we still do watch out for it. And if it does tend to cause sensitivity issues, we would definitely consider stopping the medication at that point. Other GI things we might watch out for are different anatomical issues, like if a hernia has moved where the stomach is, or if there's bleeding disorders, for instance, or previous surgery that might make it difficult. That's part of the GI safety assessment too.
Okay, perfect. Thank you. Um, so this is just clarification on another question.
Yes.
So it's the coverage is not dependent on whether or not you have low or high income. If you have low income, it just goes through AISH. Whereas if you're not on low income, if you have a normal income, then it would be through Blue
Blue
Cross.
Cross. Yep.
Okay, perfect. So,
I mean, you do have to be a part of Blue Cross. You have to have an insurance plan of some kind, essentially.
right. Okay.
Long before we start Duodopa, we would make sure that that is all covered. We haven't had anyone in Alberta need to pay out of pocket yet.
Okay. Perfect. I think that puts things in.
Definitely. That's actually one of the. So as part of the application process, I get people in touch with AbbVie. They have a sort of consumer arm called AbbVie Cares. And they do provide a fair amount of the non-medical support. A lot of that includes navigating this coverage process and making sure that you are covered in the entirety before we go ahead with Duodopa. They also do a lot of other things, such as supplying other replacement parts and accessories. They do the education portion. They can be contacted for any questions while people are on Duodopa or just general questions about Duodopa. Definitely.
Awesome. Thank you. So we had a couple more questions come in here. So why is the Duodopa pump not as common as DBS, or why is not as much heard about the Duodopa pump? So I'm not sure.
That is a great question. I think, to be honest, I think it's because Duodopa as a therapy is not as attractive as deep brain stimulation. I mean, if you look at the size of the pump, it's pretty big, it's bulky. Unlike DBS, like it's quite showy. This is something that you would wear like in a hip pack or a shoulder pack, but it's like you have a fanny pack with you all the time. And additionally, a lot of people are very concerned about like the aesthetics and the care required to take care of the stomach tube too, which I think is a very valid concern actually. So compared to DBS, where it's something that is on the surface as simple as putting in your stimulator, having the electrodes, and just turning it on, people might consider this to be more of a fussy option or a more inconvenient option. I think overall too, outside of Canada, where Duodopa is not covered regularly, I think the cost also is a issue that makes it less popular as an option compared to deep brain stimulation.
I see. Yeah, great answer. Thank you. Um, is there a wait list for this treatment in Alberta?
Yes, there is. There are two wait lists. So there is the wait list to see our Duodopa neurologist, and also there's the wait list to see the GI doctor. The types of people that tend to see us have very bad Parkinson's, so we try to move them through that wait list as fast as possible. But still, because there's a lot of moving parts, I think the wait list at this point is probably around, I want to say maybe 3 or 4 months, just as we work through all the individual parts. Unfortunately, as you probably know, with COVID, that makes things much slower overall. We're trying to do everything remotely as much as possible, including the teaching and such, but we're trying to, there's still an in-person component required for the assessments, and we do have more limited slots at this moment for that. So hopefully that will get sorted out soon. We will see.
Great, thank you. Yeah, sort of along the same lines. So do I have to come to the clinic for teaching visits, or can this be done via the computer? So are you doing?
Yes, it can be done by the computer. I can do it over the phone even. That's no problem. I mean, at some point, ideally, I would like people to have the pump around so they can feel it and manipulate it. Worst case scenario, it's as easy as sending one of these demo pumps, one of these fake pumps over to help out with the teaching process. And people can also do a bit of a dry run where they just carry this pump around with them all day to feel what it's like, to just go through that routine. Definitely, though, the basic teaching like this is something we can just do over Zoom or via telephone. No problem.
Awesome, thank you. Here's another one coming in. Is there an average time period past the initial diagnosis that people generally have a need for duodopa? So you get diagnosed at 60. How long past then is normal to receive the surgery? For
There
an example.
is not. And part of that is because of how different duodopa is between patients. So generally, for instance, if you have duodopa at a younger age, your symptoms will progress faster. And that will mean that you'll be considered for duodopa probably earlier than usual. Or you might be the type of person who's had very stable symptoms for a long time. Like maybe I've had patients who have ranged from, I think, maybe 5 years with Parkinson's all the way up to maybe 15 years of Parkinson's before duodopa is considered as an option. Instead of the timing of the disease in terms of years, we look at how burdensome and how severe the symptoms are. That's the big marker. When it gets to the point where people are just completely frustrated with their medication and where they're considering like that life is really truly impaired because of the symptoms, that's the appropriate time to come in for the duodopa.
Perfect. Another question here. Does age matter? Can you get duodopa at any age?
You can get at any age, as long as you are safe to go through with the procedure, which is very minor. It's basically putting in the equivalent of a feeding tube. You are pretty much good to go. I've had people who are 70 years old, 80 years old, and they've come in for duodopa, no problem.
Awesome. And then this is one that I missed earlier. I've heard that there are 15,000 people on this therapy in Europe. That they've commented that. So do you know how many people in Alberta or in Canada are accessing this type of therapy?
Barely as many. I can say my numbers. We have about 24 people in this program on duodopa. In Europe, it started, I think, about 20 odd years ago now. I think going on 25 years. So it's definitely not an experimental therapy. But it's just in the past, I think, 10 years that duodopa has made its way to Canada, and it started in Eastern Canada. It's just been making its way across to Western Canada over the years.
Great. Perfect. Okay, I think we'll give it 1 or 2 more minutes for any additional questions or comments for Eric. But while we're waiting on that, I'll just give my little closing spiel. So thank you so much, Eric, for being able to join us today for this webinar on duodopa. and sharing your knowledge. We really, really appreciate it. Thank you for everyone for joining, and our next webinar date is February 3rd. Our next scheduled webinar is Parkinson's Mobility. And for information on the Parkinson Association of Alberta, please visit our website, parkinsonassociation.ca, or follow us on social media. Also, this will be posted to our YouTube channel and website in the following days. So if you'd like to go back and rewatch Eric's presentation, you can do that as well. And then also another quick thank you to AbbVie for making this presentation possible as well. So, okay, sorry, a couple more questions came in. So if we can extend it slightly. One says, can we get a copy of the presentation? Absolutely. So if you go onto our YouTube channel sometime next week, the presentation will be uploaded. If you need a hand getting there or you want a link sent to you via email, you can give our office a call and someone will be happy to send you the link to the presentation. Next question, is the pump likely to be dislodged by falls? Some of us are prone to falls.
Many people are prone to falls who are duodopa patients. Absolutely. No, the pump's not likely to be dislodged. Actually, the tube itself is extremely resilient. It can sustain a surprising amount of tension and trauma. Usually, if there is a pull that's going to break something, it will actually disconnect the cassette from the tube before it actually impacts the where the tube sits in the body. So additionally, the pump itself is held in a variety of pouches that are designed to sit very close and secure to the torso. So even in the event of a fall, should that happen, or a bump or a pull or something like that, the pump is going to remain close to you and the tube will remain close to the pump. It's all generally well secured.
Perfect, thank you. And then the last one here, do you have to worry if you're outside for long periods in the winter about the cassette freezing?
So that's the other thing with the pump being stored close to the body. You don't have to worry about it freezing, in my experience, because you're usually wearing it underneath clothing and because it's close to your torso. I have a couple of people who are able to do things like hiking or cross-country skiing without too much issue, and they haven't had difficulties with the cassette freezing. I guess in very cold weather, the gel can thicken up a bit, so the pump might beep if the gel is starting to thicken up, and if that happens, you'll just want to store it closer up in a warmer place to your torso. And conversely, for hot weather, the cassette integrity is rated at 16 hours at 40 degrees Celsius. So you can go into pretty hot weather without worrying about the levodopa degrading in the cassette.
Awesome. Does the pump fit under or over clothes?
Underneath clothes. We have, over clothes too. So there are snug vests that are designed to be worn as undershirts where the pump just fits under. There are fanny packs that fit over your clothing with a sort of kind of relatively slim profile. And there's also outerwear vests that you can just kind of wear as a sort of regular vest-like option. Yeah.
Great. Okay, so that will do it for our presentation. So I'll just thank you one more time, Eric, for being able to join us today. Super thorough presentation, and I think I speak on behalf of everybody that attended. We really, really enjoyed this and got a lot of value out of it. So thank you so much for being able to be here. Again, if you want to access this presentation at a later date, check out the Parkinson Association YouTube or website, or give us a call here at the office and we can shoot you an email with those details. So thank you and have a good day.
Take care.